Coronavirus has been a serious issue in our country. Ever since it has become deadlier, with the next wave of coronavirus, it is very important to know how to protect oneself. Apart from its impact on lungs, it also severely impacts your eyes. Yes, your eyes. COVID brings with itself multiple eye problems, mainly inflammation and infection in different parts of the eye. Sadly, some of these can also make you blind, take your vision forever. Friends, I, Dr. Shweta Jain, want to make you all aware of these eye conditions and how can you diagnose and protect yourself. So in this video, I shall be talking about all the manifestations of COVID in eye. These are Mucormycosis, Conjunctivitis, Retinitis, Optic Neuropathy, Uveitis, Nodule formation. The most dangerous of all eye disease due to COVID is mucormycosis or black fungus. It's very lethal infection. It can affect the eyes, nose, mouth, sinuses, brain, lungs, and can be life-threatening. It has a mortality rate of 50%. That means over 50 out of 100 suffering from this infection succumbs to this disease and even die. So why does it occur? This fungus attacks those individuals who have low immunity and have lost power to fight infections. This is mostly seen in COVID patients with very high diabetes, those who were given high doses of steroids to treat COVID issues such as breathlessness. Steroids reduce inflammation and damage to the lungs from COVID, but they also reduce immunity and push up the blood sugar levels in both diabetics and non-diabetic patients suffering from COVID. It is thought that this drop in immunity could be triggering these cases of mucormycosis. There are also incidents of spurious oxygen cylinders in the market. Sometimes unhygienic oxygen cylinders also cause this disease. This can also occur at home or small nursing homes due to the unclean mask, tubing, and unclean water used for humidifying oxygen. The most important thing with this infection is that you need to detect it in early stage, else it becomes a killer disease. You can lose vision and even your life. So how to detect it early and treat it early? You might be suffering from mucormycosis if you have one-sided facial swelling or headache due to sinuses, you are facing nasal congestion or there is a brown discharge from nose, there is redness, pain and swelling in your eyes, you are experiencing neurological symptoms like paralysis or stroke. These are warning signs. You must consult an eye doctor, ENT or neurologist immediately depending upon your symptoms. To re-emphasize, you need to detect it in early stage, else it becomes a killer disease. So how to protect yourself from black fungus? You need to make sure that fungus stays away from your body and also make sure that you have immunity to fight it even if it enters. So I request you all to take the following measures. Do hot fermentation regularly. Gargle regularly with betadine. Use steroids only when absolutely necessary and only on doctor's advice. Please avoid self-medication. Ensure using clean and safe oxygen cylinders or concentrators. Keep the surroundings around the patient very clean. Boost up your immunity with vitamin C, vitamin D and zinc supplements. If you are a diabetic patient, make sure you strictly control your diabetes. I have created another video on how diabetes patients can control their blood sugar during COVID times. Link is in the description. Request you all to follow the above measures to prevent the black fungus. Unfortunately, if any one of you catches this infection, please don't delay contacting your eye doctor. You can also call on our helpline number. The doctor may prescribe certain antifungal medications like amphotericin B. These can be injected intravenously or even orally. But treatment is only beneficial if it is started early. This infection spreads very fast and once the infection spreads, it can lead to severe complications like brain stroke, paralysis, loss of vision, and the doctor might have to remove the part where the fungus has spread to. It also leads to death. Second, conjunctivitis. Another very common infection that comes with COVID is conjunctivitis. Conjunctivitis refers to the inflammation of eye, especially in the conjunctival region. You may have conjunctivitis if you experience redness, grittiness, watering, or swelling in the eyes. Treatment: if you get conjunctivitis, the doctor might prescribe you antibiotics and anti-inflammatory eye drops. It is advised to stop using contact lenses for some time. Next, let's talk about retinitis. The inflammation of the retina or retinitis is also a sign of COVID-19 along with conjunctivitis. Retina refers to the back of the eyeball. It is the film of the eye which sends signals to the brain which allows us to see. In case of retinitis, there will be cotton wool spots and hemorrhages on the retina. As it is the back part of the eye, so these signs can only be seen by an ophthalmologist. This infection can even travel to your brain and can be fatal, leading to death, though it happens in rare cases only. You may have retinitis if you are suffering from following symptoms: blurring of vision, black spot in front of your eye, distorted visions and floaters. Treatment includes antiviral medication along with anti-inflammatory drugs to combat the inflammation. Now let's come to optic neuropathy. Also known as optic nerve disease, optic neuropathy is the inflammation of optic nerve and can happen due to COVID infection. These nerves connect you to brain and eyes, and it is responsible for our vision. Optic neuropathy can be tested through some tests like OCT and VEP. Optic neuropathy is observed in rare cases of COVID-19 infection. You may be suffering from this if you experience pain in the eyes, vision loss, visual field loss, and loss of color vision. It requires an urgent treatment as it might lead to permanent optic nerve damage and vision loss. It also requires mild or strong anti-inflammatory drugs depending on the severity. Next, let's talk about uveitis. Uveitis is again the inflammation in the uvea of the eye. Uvea is the pigmented portion of the eye. Symptoms include redness, swelling and pain in the eyes. In severe cases, light sensitivity and decreased vision can also be observed. Treatment in this case also includes anti-inflammatory drugs with the dilating drops. Lastly, let's talk about nodule formation. Some COVID-19 patients have also shown the development of nodules in the back of the eye after getting infected with the virus. This is also seen in very rare cases. Symptoms include blurred vision and bulging of the eye. Treatment is same as earlier anti-inflammatory medicines, but if it doesn't improve with the medication alone, then surgery might be needed. So in the end, I would request you to take precautions and care around coronavirus patients. The doctors of our country are working day and night for coronavirus patients. We must avoid any complication due to any kind of negligence. In case of any query, you can call on our helpline number 9711115191 or comment below. Please share this video with as many as people as you can, so together we can fight these deadly eye-related issues from COVID. Subscribe to iMantra if you want to get regular updates about your eye health. Stay safe, stay healthy. Thank you.